Thank you so much. As you saw and heard in the earlier video, NCIC has a lot of different teams that are helping those touched by cancer. What you didn't hear are the voices of the hundreds of thousands of people from your communities that reach out to us every day. I'd like to share a few examples with you today. A typical call we get is someone who is recently diagnosed, who is so shell-shocked they didn't think to ask many questions of their doctor, and they don't remember what the doctor told them. Our staff can help them answer questions and prepare them with questions to ask their physician on their next visit. I recently listened to a call from a frustrated caller. This particular survivor was struggling with chemo brain and experiencing confusion and forgetfulness as a side effect of her chemotherapy treatment. Our cancer information specialist was able to calm her down by providing tips on how to manage this issue. Another call was from a 77-year-old lady who was felt dismissed and undervalued by her physician, who told her she no longer needed mammogram screenings. She was so thankful there was a resource that she could reach out to get the accurate information for screening recommendations for someone her age. She ended her call by saying, "My answer was as close as your telephone call, and I do appreciate it." Sometimes the constituents will reach back out to us and let us know how we've helped them, like a thyroid cancer patient who contacted ACS looking for information on insurance. In part, the patient shared this: "After a rough day of crying and worrying over insurance coverage problems that could hinder my cancer treatment, I could finally settle down and have dinner in happiness. I went from crying and panic to, I'm okay." Or from the family member of a patient who needed financial help and lodging. She sent us an email that read in part, "My cousin was diagnosed with cancer. She was separating from her husband and downsizing all at the same time. Mind you, my cousin lives in another state with no family and very few friends. Being diagnosed with uterine cancer, she had to prepare for surgery. I forgot to add, she had no income and was still waiting for a disability to kick in. I contacted the society on her behalf, and each and every time, the calls were so calming and reassuring. I can't tell you how many other agencies I reached out on her behalf, and none could compare to the ACS. Another example is from a woman who was facing a breast cancer diagnosis. Through a resource we shared, she was able to get coverage and started her treatment. She shared with us that she may not have survived had it not been for that referral. In addition, she was very lonely and isolated during her diagnosis. She was thrilled to learn about our Reach to Recovery program and hopes that someday she'll become a volunteer for the program. These are just a snapshot of the calls that we get each and every day. Each story is unique, but the common thread is we're here for them along their journey whenever they need us. I want to share that we are in the middle of creating a library of calls from constituents like this, and we'll be able to provide them to you, staff, and volunteers so that you can hear them firsthand and use them in your communities. In closing, I'd like to leave you with a few reminders. The American Cancer Society's National Cancer Information Center is a 24-hour hotline available 7 days a week, 365 days a year. When individuals reach out to us by calling 1-822-2, yes, trained specialists can answer questions about cancer, including prevention, diagnosis, treatment, and link callers to our signature programs and nationwide and community resources. We handle more than 1 million requests for information and support services each year, and we're available by phone, email, and live chat. So we truly are available in every community, really, in the world. On your tables, you'll find cards with our number on it. I challenge you to keep one for yourself, take one back to your community, and give it to a friend. The next time you meet someone that is battling cancer, make sure you give it to them. And if their family's facing cancer, give it to them. Let them know we're there for them anytime, day or night.